Hi everyone, this is Elena Apostol.
And this is Dr. Jonas Apostol.
Welcome to Apostolified Conversations. So for this episode, we're going to be talking about aesthetic dentistry, how we started, our dental background, and a lot more. So please tune in and hope you enjoy this podcast. Hello, everyone. Good day. So, welcome to Apostolified Conversations with your Apostolified Smile Squad, represented by me, Elena Apostol, and
Dr. Jonas Apostol.
okay. So, finally, after so many years, ago, pero it's actually
Years ba yun?
2 years in the making na we talked about this idea of having a podcast. Finally, after 2 years, we're here now doing our very first episode.
Congratulations, Miss Elena.
Thank you. So, nabutong idea na to of doing a podcast because it was pandemic that time, 2020. So, we explored of doing a vlog, which we did. Subscribe po tayo at the Apostol Dental YouTube channel. So, we did vlogging and thank God, thank you for all our viewers, subscribers. It was really successful. And ang galing ni Doc Jonas, vlogger na vlogger.
Grabe naman yung magaling.
So ako kasi yun, when we start pandemic, we couldn't go out of the house. It was just us. Doc Jonas siya yung ating vlogger, ako yung cameraman, director, lahat-lahat. I had help naman outside, yung cousin ko, na marunong mag-edit. Nag-edit din ako, so medyo bano yung But anyway, yun yung history. Nakita ko na maganda yung ating vlogs and I wanted to do a podcast as well. However, we got very busy.
Super
busy. But after 2 years, finally, we're here.
Yeah. Even with the vlogging, actually, it's kind of, at first, very, very difficult on my part. Kasi nga, I'm not used to this.
Sabi mo na parang simpleng dentista lang.
Simpleng dentista lang tayo. But, because of pandemic, it actually opened a door for me to this vlogging thing. Kasi I want to help educate people when it comes to oral health. Because I want to be more, I want to be more into helping them. So, I cannot do my thing, like clinical dentistry, but I can educate them on how to take care of themselves with their teeth. And that's what we did. And I'm so thankful that you pushed me to do vlogging. Kaya,
it was a challenge to push.
I know.
But yeah. Kasi syempre as husband and wife, it's not that easy na gagawa tayo na alam mo yun, another thing. Okay, so first off, we would like to formally introduce ourselves. Of course, nakita na natin si Doc Jonas sa social media. Maybe perhaps you've seen me in some of the posts as well. But to formally introduce, to give you a background who we are, I'm Elena Apostol. I graduated from I graduated from DLSU Manila and I've been working sa corporate world for 6 years. Sa bank, insurance companies, I've worked there as recruitment and marketing. So sa back office yon. And after I graduated from college, I took up masters in marketing communication. So marketing is really my passion. Yun, so after 6 years in the corporate world, here I am, 5 years with Apostol Dental dito sa dental business. And
Running 6, right?
Running 6. So that's me. And Doc Jonas, please tell them who you are.
Well, ako nga pala si Jonas. Tinatawag akong Jonas or Doc Jonas, and I graduated 2008. Tagal na, 15.
Ako nagsabi na hindi ko nga sinasabi yung years. Okay lang, parang baby face.
So, I've been practicing for 15 years. I graduated at Iloilo Doctors College, School of Dentistry. And medyo, matagal na talaga ako sa practice. After my, after graduating dental school, I took the board, and after passing the board, of course, I took a preceptorship at UP-PGH Hospital Dentistry, and also I did orthodontic training and TMJ, nathology, implants,
Craniodontics.
Cranio. Ang dami kong kinuha.
Actually,
locally.
Parang all branches of dentistry.
All branches of dentistry, and I practiced these itong branches na to before I venture into cosmetic dental
Cosmetic dentistry.
Medyo it's actually a process. I mean, I started with like super wala akong idea of magiging dentista ba talaga ako or ano ba talaga ang gusto kong mangyari sa buhay. But God led me to this profession, and nung binigay niya, I'm giving my best every single day up until now, like every single day.
Bakit mo inisip na probably won't become a dentist? Because singer po si Doc Jonas.
Sabi naman yung si Doc Jonas.
Hindi,
lang, parang gusto ko lang, nahilig lang ako sa music kasi, and music and culinary. Parang dun yung inclination ko dati. Parang hindi naman ako ganon into like, science and especially dentistry kasi hindi naman ako na-exposed. Wala namang dentist sa family. But yeah, pero hindi naman siya hindi naman siya nagiging hadlang na magiging magaling kasi isang bagay kung hindi mo siya naumpisahan bata ka pa. I mean, if the opportunity knocks, so you have to take it, you have to give your all. So ito yung nangyayari sa atin naman. Binibigay natin lahat.
Okay, so going back, Dr. Jonas, you studied or you had preceptorship with almost all of branches in dentistry.
Except endodontics.
Ay, oo nga
Hindi ako nag-root canal.
pala.
Yeah. Ayoko nun. It's not my thing. So, I have my limitations also. And I don't want to venture on something that I don't really like.
So, yung root canal, it's a very, difficult.
Lahat naman difficult, but you have to have a heart for that kind of specialty. Wala talaga ako like,
Kanal, hindi mo nga pala hindi mo talaga tinahak yung na yun.
Hindi ko tinahak yan. I tried doing it. I've had successful cases naman. Pero
Wow.
pero it's not really for me. Una pa lang. So I needed to do a shift also sa parang clarity on my part. So alam ko naman na. So I always play with my strengths.
Okay. So yun nga, you almost all except endodontics or root canal, amongst all of those branches or specialization or yung services, what did you love the most?
Well, obviously, itong aesthetic dentistry. So, after several years, like after 8 years of practicing dentistry, I gave up yung iba. Like my love sa orthodontics, sa surgery, give up ko sila just to pursue cosmetic dentistry. I mean, hindi ko sila kinalimutan. It's still there. The skills are still there. But, my focus 100%. You've seen me studying almost every day related to cosmetic. I have invested a lot with education. Like doing my master's in Frankfurt University in Germany. Been a member of American Academy of Cosmetic Dentistry for 6 years. So going back and forth to States just to learn techniques, just to gain wisdom from the best in the world. And also, I have dedicated my life talaga when it comes to aesthetic dentistry and how can I catapult myself to the next level for me to be able to help my patients na hindi tayo yung parang tipong marunong lang, magaling lang. But beyond that, we have to give, the perfect health while doing beautiful smile as well as function.
Yeah.
So, kailangan na-integrate natin lahat. So, hindi ko yan makukuha pag uma-attend lang ako. So, I need to dig deeper every single day.
So, do you know that si Doc Jonas, he's, of course, obviously, he's the man, he's a doctor for veneers, cosmetic dentistry, aesthetics, restorative. But, ang dami niya ring successful cases in orthodontics, yung braces. Before we started the Apostol Dental Cosmetic Center kasi, we just rebranded. When I joined, diba, I said I joined 6 years ago. Hindi pa siya Apostol Dental Cosmetic Center. It was named
Balanced Bite Dental Clinic.
Yun. So, yun yung actually history. Sa Balanced Bite Dental Clinic, I helped out. Kasi corporate job pa ako. But I had time after office hours to formulate mga programs, social media, nagpo-post na rin ako niyan. And we did a promotion sa braces. Hindi ko na sasabihin kung ano siya. But that's why he had a lot of...
It was successful. It was successful though.
Yeah. Thank God, naging successful siya. And it led also Doc Jonas to completing a lot of ortho cases. And si Doc Jonas, he also studied as an extern sa UPPGH. And sa UPPGH, it's very tough to be able to go there. Konti lang ang nakakapasok sa UPPGH for oral surgery and hospital dentistry. So, what he was trying to say is that all of the things that he studied in the past led him to becoming successful in what he is doing today. Na hindi ka magiging magaling right away. So, I asked you, ano yung naging love mo the most doon sa lahat ng environment? You said, of course, cosmetic dentistry. But really, you cannot be a top-tier dentist in that field if you did not go through all of having to study or tapping the other branches in dentistry.
Exactly.
Like you were saying about function, the health.
It's really hard to like go straight to cosmetic dentistry because you need to understand dentistry system. You need to understand also the functionality. You have to have the mileage in dentistry, the experience in different field, because cosmetic dentistry kasi ano yan parang nasa dulo na yan. After completing lahat-lahat, hindi siya yung parang tipong pampaganda lang. Like, we are talking about the functionality and health. That's the reason why I've seen a lot of cases, no, na hindi successful, na ang daming complaints from from the patients, no, na sinasabi nila na when you have veneers, nagkakaroon ng problems like bad breath,
Sa
daming
TikTok natin or
Mm.
even Instagram, they comment, ayaw ko mag-veneers kasi nakaka-bad breath yan.
Exactly. And ang dami nilang ganong sinasabi, or which is sometimes it's true. Kasi pag nakikita ko yung gawa, it has to be science-based eh. It has to be systematic.
It's true if it wasn't done the right way.
Yes.
But it is not true if you did it the right way.
Exactly.
Which is
Exactly.
that's why-
We have to lessen the factor na pwedeng maka-affect ng success and longevity of the veneers. Yung pinaka-hot topic talaga natin palagi kasi yun yung palaging ginagawa natin dito sa clinic, and a lot of questions talaga usually leading to what the advantages.
For you, what is Apostol Dental Cosmetic Center? Of course, yeah, given it's a clinic, obviously, we provide dental services. But for you, what is really Apostol Dental Cosmetic Center?
Well, Apostol Dental Cosmetic Center, I want to be known as that this clinic, hindi siya yung tipong dental clinic lang na pupunta ka sa akin, you will get a pasta and you will get a cleaning. I want to be Apostol Dental Cosmetic kasi if you heard that name, we are into dentofacial cosmetic, wherein we fix your teeth systematically. Also, we are including the facial aspect, like babagay ba yung smile mo sa'yo? Makaka-affect ba siya sa total health mo? Kasi if it's not done correctly, then it can actually cause any detrimental effect, not just to the teeth but also to the face and to the whole system. Kaya we have to be careful in implementing our dentistry here at Apostol.
So, Apostol Dental Cosmetic Center, since you are the smile maker dito sa clinic, is really to provide yung systematic approach, quality service result that will, yung longevity of your smile. Maganda, at the same time, healthy, functional, and
Beautiful.
beautiful, and tatagal ng matagal.
Yeah.
Hindi yung parang, maganda siya 1 year, and then after that, wala na. It failed. So, longevity. Actually, yan ang Apostolified smile.
Mm-hmm.
That is ito yung binabrand natin, confidently beautiful Apostolified smile.
Well, ang ano kasi, in addition, no, to the what is Apostol Dental, yung sinasabi ko nga, up until now, I'm still, studying and honing my skills. Also, kasali yun yung biomimetic restorative dentistry, as hindi ko siya na-mention kanina. Hindi ko siya na-mention kanina, yung sa training ko ng biomimetic restorative dentistry. I took that kay Dr. Alman sa States, and he's really, really brilliant. He taught me a lot, and the understanding of like a basic restoration. It's not like a basic restoration. There's a lot in there. Like there's science behind everything that we do. And I want to be branded as scientific yung approach natin dito. Ayoko yung parang, dito, pagpasta para-parehas lang. No. Here at Apostol, it's our pasta here is a biomimetic restorative approach. And we are talking, we're looking at something na evidence-based talaga na tumatagal. So hindi ako nag-stop. hindi ako nag-stop mag-learn. I always make sure that I improve.
So, Apostol Dental Cosmetic Center is a place where there will always be innovation in dentistry.
Tumpak.
Okay, so for me naman, let me share with you how I see Apostol Dental Cosmetic Center. It's actually, we brand it as a marketing person, as a chief marketing officer. We brand it really as a luxury dental clinic. We offer all dental services, but the one that we would like to promote most is yung veneers, restorative, fixed bridge, implants. So, apart from that services that we want to offer, na marami rin namang nag-offer the same thing that we do, what sets us apart, what sets Apostol Dental Cosmetic Center apart is the apostolified smile that we give to the patient. Yung result ba? Magandang result, quality result, healthy, inulit-ulit ko, healthy, functional, beautiful result, because that's really what it is. At the end of the day, that's what our patients want. Yeah, beautiful, but healthy and functional at the same time. But apart from that, the most important thing, na ano ba talaga kami, is being able to give the purpose for our patients. Deeper purpose. Na yung apostolified smile na maganda, it helps our patients be more inspired to do more, be better in life.
Yeah.
Na when they smile, wow, ang ganda.
Exactly. That
The feeling ba, yung
that can add value to their lives.
yes.
Yeah. Quality of life.
Quality of life, correct. And sometimes kasi, some of our patients, they go here feeling sad and depressed. They don't know what to do. Hindi naman tayo nag-name names, but they're down, they're sad. And all they wanted is to get an apostolified smile. And after getting that apostolified smile, happy sila sa result, happy sila sa result, they grow they flourish yung life nila.
I've seen it.
Diba? They start, example, small entrepreneur na medyo sad nga, medyo insecure because of hindi maganda yung smile niya. Not blessed with a nice smile. After getting that apostolified smile, after a few months, boom, lumaki yung business.
Yeah.
Ang dami na niyang napatunayan. Ito pa, ito. This is nice. Sad siya kasi kaka-break lang niya. Gusto daw magka-boyfriend ulit. May mga ganyan. Sobrang funny. Every day, Dito, ikaw magkwento niyan kasi ikaw palagi mo sinasabihin sa kanila.
Ikaw na.
Hindi, sorry, magkaka-boyfriend.
Hindi, ikaw na. Tapusin mo na.
Sige. So, pupunta sila, kaka-break lang, gusto daw nila magkaroon ng partner ulit. Sasabihin ni Doc Jonas, Ma'am, papagandahin kita. Ready ka na bang gumanda? Kasi magkakaroon ka talaga ng boyfriend. Aba, after, di nagawa na. Okay, after 1 week, tapos na. After 1 month, bumalik. For follow-up. May dinidate na. Kasama niya yung boyfriend niya dito sa clinic, di ba?
That's actually usual na nangyayari dito. Because kasi...
mababaw lang yun.
Mababaw lang yun. Actually, ang daming
mababaw yun, pero actually, hindi pala mababaw sa iba.
For some, akala nila, like, different kasi ng ng mga battles in life. And, let's say, yung insecurity nila. But for some, na yun yung battle nila, insecurity nila to. So I'm here. I am here to help those people. Baga, God placed me in this position to help them. Baga, hindi ko naman mapiplease lahat. Hindi ko naman matutulungan lahat. But in my own little way, matutulungan ko yung kailangan ako. That's the reason why I always make sure na innovated tayo every single time. Like, when I say innovation, hindi siya yung parang I have perfected yung ganitong technique. Notice mo, ang dami kong tinweak na technique from clinical to laboratory to gamit. Kasi ang dentistry kasi and medicine, grabe ang innovation. Like the innovation, you can see every single day may mga bago na mga studies, may mga bagong discoveries. So you have to be parang open to that. But I'm the type of person who always dig deeper, diba? So inaaral ko talaga yung mga systematic literature of the new things, and I don't like based directly on what I feel. I based on the evidence, no, and the success na produce ng mga the best na in the world who did conducted the research. Kaya hindi tayo basta-basta lang na kung anong sasabihin sa atin. So yeah, that.
Yeah. So yun, Apostol Dental Cosmetic Center is a luxury dental clinic with the purpose of providing apostolified smiles to our patient that will enable them to become a better person. Sinamarize ko na.
Dapat ikaw talaga nagsa-summarize. Kasi hindi ko siya masummarize.
So, because ang popular term is cosmetic dentistry,
Exactly.
I have a question for you, Doc Jonas. Being a practitioner of cosmetic dentistry here in the Philippines, can you share with me ano yung mga naging challenges or difficulties mo in the past year, past years that you've been practicing? Na yun yung focus mo?
Well, to be honest, no, I trained cosmetic dentistry 10 years ago. Okay, so nag-train ako before. Ang tagal bago ako
focus.
Bago ko siya na-focus. Why? Because siguro hindi pa ganon 10 years ago, hindi pa ganon siya kasikat, no, yung cosmetic dentistry.
Kasi parang tabu na, ay, retoke, parang ganyan.
Yeah.
Or nakakatakot.
It's more of like nakakatakot na ano. Tapos yung knowledge siguro when it comes to that, hindi pa ganon kadami. Also, ang pinaka-challenge sa akin before was the selection of material. Ang dami kasi you will be introduced a lot of materials available in the market and you have to choose what's best. Pero ang problem kasi nun, sometimes nagkakahalo-halo na. And then the understanding of the morphology and anatomy of the teeth, it's very important. And also the chemical components that would really help the bonding effect, the bond strength. You have to be knowledgeable. What are
dami-dami mo yung sinasabi.
Yeah, ang dami. Oo. Even with the design, I mean, smile design is very important. That's why when I started yung parang nag-start ako na nag-bloom sa cosmetic dentistry, I started with direct veneers, diba?
Yeah.
Notice
direct composite.
Direct composite veneers. I did like thousands.
Composite is the parang hindi siya parang yung pasta.
Yeah, it's a pasta material. Yeah. I did thousands of that. Imagine that. I mean, ang dami talaga. Tapos, nakita ko yung difference. I mean, may mga successful, may mga nag-fail, may mga tumagal na matagal up until now. It's still there. It's still beautiful. Pero, yung understanding mo about pathology, the bite, everything, the grinding, lahat ang dami kong struggle na parang nakakatakot actually na gumawa ka ng veneers tapos you don't really understand the totality of everything. Kasi we're not just about teeth. we are talking about the nerves. We're talking about the muscles. We're talking about quality of life, the psychology before and after.
So you mean one of the difficulties in this branch is yung pagiging complicated niya as it is?
It's very complex. It
Yeah.
is very complex. We are talking about the material, the teeth, the people. Hindi pa tayo we are not yet in the yung parang problems, other problems such as, is it like subject for root canal? Is it subject for grafting? Is it subject for perio?
Period.
Is it ang dami nating tinitingnan. May TMJ problem ba tong pasyente? Or hindi niya lang sinasabi, pero nagsasuffer pala siya. So, ang dami nating problem. As a cosmetic dentist, ang dami-daming pwede nating ma-encounter. Kasi akala natin pag okay na yung itsura, pwede na. But, hindi dapat ganon. We should never focus on the beauty itself.
Yeah.
Yeah. We have to focus on health. Because at the end of the day, I'm a doctor, I'm a dentist, and we are I am subject to giving them health, to providing health, function, and also yung as a cosmetic, yung beauty naman.
So, yun.
Ang gulo talaga.
Complexity.
Sobrang complex ng cosmetic dentistry. Kung pwede akong mag-suggest na kunwari, would I suggest na sa ibang young dentist na if they want to pursue? Yeah, of course, because it will really help yung mga patients. But I would encourage them to study further. Hindi dapat yung parang okay, I'll just go jump directly to cosmetic dentistry. Hindi kasi hindi siya ganon. Dapat
because it will affect the patient.
Exactly. Dapat you have to have that in-depth understanding talaga of what is dentistry to the core. Sagad hanggang buto. Dapat hanggang ganon talaga. Kasi ganon talaga. I mean, we have to be knowledgeable. So dapat we have to know the science behind what we're doing. It's not like isa lang. Isang science lang. Hindi pwede.
Okay. So, you've mentioned earlier yung mga, what was that? Sila, Dr. Alman, yung biomimetic, AECD. I want to go back to that. Can you tell us what specific conferences, seminars, preceptorship, trainings, etc. yung mga tinake mo before or currently, before or up until now, focused on cosmetic dentistry? I'm asking you this, Doc Jonas, because a lot of dentists here in the Philippines, abroad, marami nang nagpa-practice ng cosmetic dentistry. TikTok, makikita nyo yan. But patients kasi sometimes, they do not know where to go. Kasi, ang ganda ng result nito. So, pumunta siya doon. So, ito, specific patient, this patient saw a post on TikTok. This patient went to that dentist availing of veneers. Kasi yun yung nakita niya. After a week, pumunta sa atin because nakita rin niya yung post natin na maganda. But, nagawa na siya ng veneers 1 week before. Bakit siya pumunta sa atin? Kasi hindi maayos yung pagkakagawa dun sa 1 week before na pinuntahan niya. So, what I'm trying to say, and why am I asking you this is, there are a lot of dentists who can do this. But as a marketing person, what sets you apart dito sa mga dentists na to is the trainings, the education, and a lot more, and your background sa cosmetic dentistry.
Sige,
Yan.
sasagutin natin yan. Ganito lang yan kasimple. before I took my master's.
So what sets you apart in terms of education?
Okay.
Okay.
So, ganito na lang. Pero hindi. Yung thought ko kasi about when it comes to to that question, what sets me apart, is that may ako like a tinge of obsession when it comes to dentistry. When it comes to this cosmetic field, iba yung hard work na pinutin ko dito. Like, if you will ask me why am I confident with my skills, it's because of all the hard work I put in. Like, you've seen it. Grabe. Kahit hindi ako matutulog, just to work, study at the same time. Yun. Regardless of my training abroad, yung lahat na binuhos ko dito, oh my gosh, sobra to. Para akong deep, sobrang deep, na medyo nawala ako sa sarili. Grabe naman. Medyo dumating sa point na wala akong ibang iniisip kundi ito lang. Pagising ko sa umaga, cosmetic dentistry, aesthetic, how can I improve myself? My skills, everything. Not just clinically, but also theoretically. So that's the reason why I went abroad. I went to the States multiple times just to gain knowledge from the best in the world, not just in the US, but in the world. And it did not stop me from pursuing to be a better version of myself. I went to Germany for my master's in aesthetic dentistry. So I have invested time, money, effort, lahat. Ininvest ko siya for me to gain not the title alone, but the knowledge that will never be taken away from me. Yeah, yeah. And ito yung mga investment ko na number one. I invest in my mind, and number two, I invest in my clinic. Okay? I invest in material, I invest in machines, I invest in people. So, notice mo nandito ka sa Apostol Dental because you're part of my vision. Nakita ko na that you will be part because I know your strengths. Lahat dito na mga part of my team, mga tao sa mga employees natin dito, I've seen this already kahit nung nandun pa ako sa isang maliit na clinic na wala akong assistant. Na mag-isa lang ako, nagde-daydream ako. So, these are visions in the past. Pero nag-hold on ako doon because I believe in my vision na someday dadating ako sa point na to. So, I invest in people like my laboratory technicians, the machines that they are using na hindi siya compromising. Like the CAD/CAM, they're all from Germany and they're not cheap. They're all expensive. What we use here are all expensive. So, hindi deserve ng patients natin na magkaroon ng cheap na gamit or cheap na process. Irregardless of the clinic, we always provide the best material, the best craftsmanship, and the best result for all our patients. Yan naman yan yung pinaka that would set me apart from others. Kasi nilalagay ko lahat yung heart and soul ko.
Okay, so you mentioned earlier yung galing ka lang sa small space, sa small clinic. can you briefly share with everyone here,
Briefly.
briefly,
Sige.
anong history of your practice?
History of my practice. So I started 2009. Yeah, 2009. Meron akong nakitang clinic before. It was a time-shared practice. May mag-ama na government employee. So medyo hindi to brief So mag-ama na nagpa-practice sila ng private plus government. So wala sila the whole day. So nagre-rent ako doon. And yung katabi nun, may vet clinic. So bago ka pumasok sa makadating sa dental clinic, maamoy mo muna yung vet place. So medyo hindi siya ganun ka-ideal. But pwede na. May mga patients na din na nagtiyaga sa akin dati. Sa 2009. So tagal na, no? 13 years? 14 years. So I started that. Tapos, may nag-refer sa akin na classmate ko dati sa orthodontic preceptorship. Sabi niya, dito sa Makati. Makati din pala yun dati. Dito sa malapit sa atin. Meron din dito nag-o-offer. So, timeshare din. Ganon. Pero mas better na. Wala nang vet clinic dun eh. So, I stayed there for 5 years. Pero parang on-call. Kasi 2013, I started my own. So, sa may Guadalupe. It was a 10 square meter space. So, syempre, sobrang akong proud, diba? Kasi I have my own space.
10 square.
12, kasama na yung CR. 12 square meters, kasama na yung CR. Tapos, dun pa ako natutulog. Okay, dun ako natutulog sa clinic ko. Clinic sa umaga, boarding house sa gabi. So, doon ako nag-start. And, syempre, proud moments ko yun. Kasi, nakalagpas ako doon. And also, I have...
Hindi mo na-mention yung associate dentist ka.
Yeah, nag-associate dentist pala ako for a year. Pero medyo di siya full-time. Part-time lang din. Kasi I have my own practice nga na konti pa lang yung patient ko. Pero, alam mo yun, I stayed there sa may Guadalupe for 3 years. 2 years mahigit.
Yung 12 square
Yung
meters.
12 square meters. Tapos, nagkaroon ng spot dito sa Medical Towers sa Makati. So, nagkaroon ako doon ng space na 21 square meter. O, diba?
Saking double siya. Okay.
So, na ako doon. Mas bongga na siya kasi, may guard na sa baba. So, hindi na ako natatakot na baka may papasukin yung clinic. So, sobrang proud ako noon. Tapos, after that, diba, parang we were planning. Kakakasal lang natin eh. We were planning to migrate, diba? So, hindi natuloy. Kasi parang na-realize ko na i-try natin muna to work together. So, yun. After 2 years, pumayag ka na nag-join sa akin. Isa pa lang din. In 2017, dahil pumayag ka mag-join sa akin, naging ang yung 1 unit ko na 21, naging 3 units siya. So, naging 65-ish square meter ng 2017 because you joined. O, diba? Tapos after that, 2018, kumuha ako ng another unit sa 5th floor. Tapos 2019, I added 2 more units. 2020, I added 1 more. So, nagkaroon tayo ng 7 units sa Medical Towers. Tapos, syempre, nag-iisip na ako ng more, growth pa. Sabi ko, inisip ko pa dati mag-add ako sa Medical Towers. Pero, parang feeling ko it's not really meant to, parang stay there. Because for some reasons, I mean, pandemic, we needed a space, big space. That's why, nag-check tayo ng mga places. And ito, napadpad tayo dito sa kapitbahay natin na building.
100 steps away.
100 steps away. Actually, yung adjacent ng building na to, yung sa harap, dun ako nag-start sa City Land.
City Land, yeah.
for 5 years. Tapos sa adjacent ng Cityland naman, Medical Towers, stayed there for 7 years. Tapos katabi ng Cityland, sa may right ng Cityland, dito naman sa Electra. So dito tayo. Parang
And right now, Doc Jonas, how many square meters itong current clinic natin?
So this is a 550 square meter clinic. 550 with 7 operatories and 7 chairs and then 1 laboratory. We have our own laboratory, dental lab. We also have a CBCT, X-ray, panoramic Ceph. We have everything here sa clinic. So that's really
One-stop shop.
One-stop shop. Yun, that's really the plan. I mean, it's not like parang pagkagising ko sa umaga ito na yung gusto ko. Step by step talaga yung journey na it was actually a big project for me na I never thought before na dadating ako sa point na to na I will be getting this big of a clinic, and it's a luxury clinic because we did not put a lot of chairs in here. Sa laki ng clinic na to, pwede tayo maglagay ng 20 chairs. Pero the goal kasi it's not to cater all people, but to cater few people that need me. Yung few na yan, hindi ko kasi lahat matreat. So, ano lang din tayo. We have to be, realistic.
Okay.
Yun. Anyway.
So from 12 square meters, 21, 65, plus kasi nagkaroon tayo ng maraming units sa medical towers, to 550
to 550.
meters. Grabe the journey.
Wala pa yan.
Wala pa yan.
So,
innovate.
Yeah, exactly. Because our goal is not really to stick and maintain what we have right now. My goal, my goal, if God willing, is to elevate pa more, to create an impact not just to my community but also to the world. Yan yung goal naman talaga ng Apostol Dental. That's why we don't stop innovating and learning a lot of things.
So thank you for that brief.
Sabi ko sa'yo, pinigilan ko na nga lang yung sarili ko eh.
Okay.
So, ako magkwento.
So we have a lot more episodes to come. First episode pa lang naman to Doc Jonas. And we can share more things sa ating next episodes. So, this is our first episode sa ating Apostolified Conversations podcast. What can we expect sa future episodes natin is probably we will be sharing with you cases, actual cases.
Mm-hmm.
We might invite guest speakers, patients, influencer ba to, normal patient ba to? I mean, example, IT employee, hindi natin masabi, but we will definitely ask a real patient, have a real conversation with an apostolified patient. What else can we expect? For Dr. Jonas to explain in detail the other services, the cosmetic services that we offer here. Mga purposeful, meaningful life lessons coming from Dr. Jonas, motivational talks coming from him, and a lot more. So,
I'm excited.
To wrap up this podcast, Doc Jonas, what ano yung ating words of wisdom to wrap up this episode?
Words of wisdom. Well, this is one of my favorite quotes, no? Tong hard work beats talent when talent refuses to work hard. Kasi at the end of the day, it's not really how talented you are, how bright you are. It's actually how much you put in the work. Kasi irregardless kung gaano ka kagaling, kung tamad ka, hindi ka talaga mahirap maging ma-achieve yung gusto mong ma-achieve because it requires a lot from an individual to be able to get the price that you want. So, yun yung, yeah.
And for me naman, I'm really happy. Again, I'm really happy that we're doing this because finally we can share another avenue of the work that we do. It's beyond providing dental care, providing beautiful smiles. It's beyond that. It's being able to share to the community, share to the people what we can offer meaningful, purposeful work, and that God's purpose sa ating dalawa is to help other people.
Yeah. Exactly. I mean, that's the reason why we're here. Because of our purpose. That yung in-entrust sa atin ni Lord, which is ito yung profession na to. And I'm thankful that you're para part of my team.
Thank you. Okay, so thank you very much, Dr. Jonas, and thank you everyone for joining, listening sa aming podcast. Expect a lot more, and thank you very much. If you have other suggestions sa ating podcast, you can DM us sa aming social media accounts. We're gonna put in our social media accounts. Follow us, subscribe, please, and thank you so much.
Thank you. Thank you, guys. Thank you.
See you all in our next episode. Bye-bye.
Bye.